Okay. We'll record this. Okay. Bismillahirrahmanirrahim. Assalamualaikum and a very good morning. How are you today?
Waalaikumsalam, fine doctor.
Fine, doctor. Just finished the lecture. Huh? Okay, let's late. But never mind. We'll get started lah. Okay, so continue with the lecture yesterday. Yeah, it's on the mechanism of sulfonamide and trimethoprim. Okay, right. So in sulfonamide, yeah. As for sulfonamide and trimethoprim, okay, usually they are added in one combination, yeah, and it produces this synergistic effect. So how it works, yeah, okay. So actually, PABA refers to p-aminobenzoic acid, okay. So PABA is an intermediate, yeah, PABA. Let me show you where is the English? Not coming out, never mind. Okay, PABA is an intermediate or a compound, yeah, in the bacterial synthesis, yeah, of folic acid. Okay, so PABA is required, yeah, for the formation of the folic acid in the bacteria, right? So PABA, yeah, will convert to a dihydrofolic acid. Yeah, all these are folic acid, dihydro and tetrahydrofolic acid. They're all folic acids. Yeah. So PABA converts to dihydrofolic acid. Yeah, with the help of this enzyme, okay, dehydrotereorate synthase. So this enzyme has to be present, yeah, to catalyze PABA into dihydrofolic acid. So sulfonamides, yeah, it inhibits the enzyme that is responsible for the conversion of PABA to dihydrofolic acid. Okay, and trimethoprim and or O-methoprim, yeah, it's either one, yeah. We added the sulfonamides. So it inhibits the tetrahydrofolic acid. Okay, same thing, yeah. Tetrahydrofolic acid, THFA. Yeah, again I repeat, it stands for tetrahydrofolic acid reductase. So this is the enzyme, yeah, that is responsible for the conversion of dihydrofolic acid into tetrahydrofolic acid. Yeah. Okay, so many will ask me, okay, why doctor, it's sulfonamides already inhibited dehydroterate synthase enzyme, so why do we need this trimethoprim? Definitely, you know, it's the mechanism has been interrupted, you know, it won't produce DNA, but by giving trimethoprim or O-methoprim, yeah, it works synergistically, yeah, and it's making sure that there will be no, you know, no production, yeah, of dihydrofolic acid, yeah. It's making sure like double confirmation lah, yeah. There's no production of this the tetrahydrofolic acid, because tetrahydrofolic acid, yeah, will then synthesis into purines and DNA of the bacteria. Okay, so therefore usually it is given in combination. Sometimes there are formulation where sulfonamide, yeah, sulfur drug is given alone, yeah, and sometimes it's given in combination with trimethoprim or O-methoprim. Okay, is that okay? Clear?
Yes, doctor.
Yes, doctor. Okay, good. Okay, now I will move on to the next drug, yeah. Hang on a minute. How to this exercise, we will skip the exercise, it's okay. So I'll move on to the next, we'll share another document, yeah, another PowerPoint slide. I'll close this, yeah, I'll close, stop sharing. We'll talk about beta-lactam penicillin, yeah? beta-lactam drugs, yeah. Okay. Right. Okay, so in the first slide, yeah, this is on the learning outcomes. So basically for antibacterial drugs, yeah, antibacterial, antiparasitic and antifungal drugs, yeah, this would be the common or generic learning outcomes, okay? So usually I will ask the student, yeah, to list down the common drugs, yeah, of that group, that particular group. So today we're talking about beta-lactam, all right? So you need to know, you know, the common beta-lactam drugs, yeah, used in veterinary practice. The most important one is at least you must know the drugs that are being used in UVH in our hospital. Yeah, so that one should be at your fingertips. And number two, be able to describe, yeah, the mechanism of action. Usually when I describe the mechanism of action, I'm not going in very detail at the cellular level. So this is like very brief mechanism of action, yeah. The clinical indications, yeah, or clinical uses, and adverse effects of the common beta-lactam drugs. Okay. So the beta-lactam, you can't see the title, okay. Beta-lactams, yeah, that I will discuss, yeah, today are the penicillins and cephalosporins, okay. So these are the among the most commonly used antimicrobials, yeah, very effective with low toxicity, yeah. So all beta-lactams contain the beta-lactam ring. So that is the reason why they are referred as beta-lactams, okay. So the beta-lactam ring, yeah, is the ring that in the molecular structure, yeah, that confers the activity that produces the antibacterial activity. Okay, and then this ring, yeah, the beta-lactam ring, can be degraded, okay, by the beta-lactamases. Okay, beta-lactamases here refers to in the case of penicillin, yeah, it is referred as penicillinase. So in the case of cephalosporin, it will be referred as cephalosporinase. All right. So what is the beta-lactamase? Yeah, it's actually the bacterial enzyme, yeah, causing inactivation of the penicillin, yeah, at the beta-lactam ring of the molecular structure, right? So a little bit on the antibiotic resistance. So I think this just to show you, I think I've covered this in my previous lecture, yeah, this the ability of the bacteria and other microorganisms, yeah, to resist the effect of antibiotic to which they are once sensitive, okay. So at the first time, yeah, when you use it's sensitive, but when you use like the second time, yeah, it's not effective. So therefore you have to change to another antibiotic, yeah, that is antibiotic resistance, yeah. Okay, go to the next slide. Okay, so discovery of penicillin and emergence of penicillin-resistant bacteria. Even those days, when they developed penicillin, they already discovered the resistance, yeah, to the drug. All right, so in 1928, yeah, so that penicillin was discovered by Sir Alexander Fleming, yeah. So this was the one of, I think I would say the first antibiotics like discovered, yeah. So in 1940, yeah, so the purification of the penicillin, yeah, by Sir Florey and Chain, okay. And in the 1940 itself, yeah, they noticed the emergence of the penicillin resistant bacteria. So that fast, okay. And then in 1941, okay, confirmation of the clinical effects. Only after 1 year, they discovered the clinical effects, and they start with the production in 1945. Okay, and Sir Alexander Fleming, yeah, was awarded the Nobel Prize. Okay. And so what he said in his speech, yeah, in 1994, yeah, when he accepted the Nobel Prize, he said, you know, the time may come when penicillin can be bought by anyone in the shops. Then there will be the danger that the ignorant man may easily underdose. So this is where, you know, the spread of antimicrobial resistant bacteria will happen, yeah, when you give antibiotics and you underdose, yeah, underdose himself, and by exposing his microbes to non-lethal quantities of the drug, making them resistant. So, you know, so this is what he has mentioned, yeah. So that's why we have a law now saying that antibiotics, you cannot buy antibiotics from the pharmacies, right? You cannot go to any pharmacy and buy antibiotics. It's only under prescription, which means you need to see a doctor, and the doctor will prescribe the antibiotics accordingly. Okay, so nowadays we are very strict, yeah, with the regulation because of this antimicrobial resistant bacteria. It's overwhelming. So therefore, you know, doctor will really check whether do you really need antibiotic or not. Huh? If you're having a common flu, no, you don't go for antibiotics. Yeah, so antibiotics are now reserved for severe bacterial infection. Okay, this is the structure of penicillin, yeah, I was talking about. Yeah, the beta-lactam ring. Okay, this is the ring, yeah, that confers the antibacterial activity. So usually when resistance occur, so you know, it's due to, you know, inactivation of the beta-lactam ring, yeah, which causes the antibiotic, you know, cannot produce the desired effect. Okay. Right. So briefly on the pharmacokinetics of beta-lactams, yeah. So this one will apply both for cephalosporin and penicillin, yeah. So the absorption, yeah, it's variable, impaired by food. So therefore, sometimes these drugs are given before food, you know. So when you take like antibiotics like amoxicillin, sometimes doctor will say, okay, you take it before food, half an hour before food, yeah, for better absorption. So distribution, most tissues, yeah, except CNS, yeah, and prostate, unless it is inflamed. Okay, elimination are mainly in urine. So what are the common antibiotic in veterinary medicine? Yeah, so we'll look at that in a short while. So the spectrum of activity, okay, of penicillin as a whole, yeah, it is effective against gram-positive aerobes and anaerobes, and gram-positive bacteria, gram-negative bacteria. So here, you know, you will look at the classification, yeah. So the older generation, yeah, will be only effective against gram-positive only. Okay, so when they improve the formulation, then, you know, it came out with a formulation where the drug can kill both the gram-positive and gram-negative bacteria. So briefly, yeah, the mechanism of action. So the drugs, yeah, they interfere with the development of the bacterial cell wall. So please remember, yeah, beta-lactams, yeah, will affect the bacterial cell wall, yeah, and causing the bacteria to prone to lysis, yeah, okay, which has been degraded, okay, so it become lysed due to the osmotic imbalance, okay. So water, it will just will draw out from the bacteria. And also the second mechanism is it inhibits bacterial enzymes, yeah, for construction of the bacterial cell wall. Okay, this one, okay, especially for drugs like within the same group, but these are for amoxicillin, potentiated amoxicillin, where it has combination with clavulanic acid. Okay, so the clavulanic acid, yeah, is responsible, yeah, for the inhibition of the bacterial enzymes. Okay, right. We'll look at the classification. Yeah, what are the common antibacterial drugs of penicillin group? So firstly, natural penicillins. Yeah, this one is the oldest group. Yeah, of penicillin. We have penicillin G, yeah, and penicillin B. Okay, so penicillin G is also referred as benzyl penicillin. So this is according to the molecular structure, yeah, of the penicillin. Yeah, it's got a benzyl structure attached to the penicillin molecule. Not recommended orally, yeah, due to poor absorption, yeah. So it is not acid stable. So when you take it orally, yeah, easily degraded by the gastric juice. So all species for infection, so it's being used for in all species, yeah, for infection caused by gram-positive anaerobic bacteria. Okay, so please remember that this is the spectrum of activity of penicillin G. Okay, so this is the drug of choice for streptococcal infection, yeah, causing like pharyngitis, pneumonia, meningococcal infection. Okay, so this would be a drug of choice for these problems in the animals. Penicillin B, yeah, it's very similar to penicillin G, but can be administered orally. Yeah, they have improved penicillin G and came out with penicillin B. Can be administered orally, very stable in the acidic environment of the stomach. Okay, so the difference is penicillin G is only for injection, yeah, whereas penicillin B is for oral use. The second group is the penicillinase stable penicillins. Okay, so this group of drugs, they are used for severe staphylococcal infections caused by beta-lactamase producing organism. Okay, what are beta-lactamase producing organism? These are such as staphylococcus, yeah, E. coli, what else? The harsh bacteria such as Pseudomonas, Salmonella species, yeah, yeah, they produce the harmful enzyme, bacterial enzyme. Okay, so so drugs that can use for this staphylococcal infections, yeah, are this oxacycline, yeah, cloxacycline, dicloxacillin, dicloxacillin, and oxacillin. Okay, the next group, yeah, but this is a very popular, yeah, yeah, both in human and veterinary practice, yeah, the broad spectrum penicillins, yeah. So we have ampicillin, amoxicillin, hetacillin, yeah, all these are acid stable, yeah, are very common in veterinary medicine, yeah, penicillin. Okay, so Betamox, I think I've mentioned this before, and I also showed you picture on Betamox. Yeah, Betamox contains amoxicillin. Yeah, it's not penicillin, amoxicillin actually, Betamox. Yeah, so they're in the same group. Yeah, okay, so they're available for oral and the oral and injectable form. So for oral, we have capsule, liquid suspension, yeah, and the others would be for injectable. Okay, amoxicillin. Okay, So the later drug, after ampicillin would be amoxicillin. Beta-mox is amoxicillin, So usually it has got a special coating, for easy oral administration. So this drug, broad spectrum, when I say broad spectrum, okay, they're effective against the gram-negative aerobes as well. Okay, gram-positive and gram-negative aerobes such as E. coli, Proteus, and Haemophilus species. Okay, so it's very safe. Commonly used in the many species of animals. Bimoxi, Betamox, Bimoxi. So Bimoxi, it contains amoxicillin, 250 milligram. Okay, so this is in the caplet form. Okay, so carbenicillin, another broad spectrum penicillin, it can be used alone, or in combination with gentamicin. So gentamicin belongs to the group of aminoglycoside. Okay, it's a different group of antibiotics, aminoglycoside, and aminoglycosides are also bactericidal drug. Okay, so carbenicillin, is a penicillin, is a bactericidal in combination with gentamicin of aminoglycoside. So both of this drug will produce the synergistic effect. Okay, so they are used in the treatment of Pseudomonas species. So the other drugs would be like acetylcysteine, piperacillin, and so on. So this have extended spectrum of activity. So they are effective against gram-positive and gram-negative organisms such as Pseudomonas, Enterobacter, Klebsiella, and so on. Okay, so the last one within the penicillin group is the potentiated penicillins. So these are very potent drug of the penicillin group. They contain clavulanic acid. So clavulanic acid, is responsible, to inhibit the beta-lactamases, the bacterial enzyme, that are being produced by the penicillin-resistant organism. Okay, so and it's also being combined with amoxicillin. So amoxicillin itself a broad spectrum antibiotic, but it is being combined with clavulanic acid, to produce the desired effect lah. That means it's a very potent drug among the group, among the other drugs in the group. Okay, that's why it's being stated as potentiated penicillin. Okay, like just now, sulfonamide, a sulfur drug, combined with trimethoprim, is referred as potentiated sulfonamide. Okay, that means it's a very potent combination of the drug. Right? So another formulation, besides clavulanic acid and amoxicillin, we have sulbactam and ampicillin. Okay. So this is a drug that commonly used in our practice and also in UVH. So it has got different trade names such as what are the trade? Clavamox, Clavalox, Clavamox. It comes with different names, but the active ingredient is the same: clavulanic acid and amoxicillin. Okay, Clavamox. I just mentioned this now. I've showed this several times. So a very popular drug used in animals. So the human preparation, the human formulation, Have you heard of augmentin? Anyone?
Yes, doctor.
So you have taken augmentin before, Who is this?
Raja.
Raja. Have you taken augmentin before, Raja?
I remember taking once, like a few years back when I was very ill with something.
ni you ill with? What did you have? What problem?
I wasn't sure. I think it was
Bacterial
fever
infection.
and
High
fever and
fever.
few other stuff.
So what did you realize augmentin the content? Can you're not aware of that lah at the time, huh? But
When I saw the box, like it was augmentin, then when I looked around it, I think it was a mixture between two antibiotics. I wasn't sure what were they.
okay, good. So that's the same thing. Yeah. So augmentin it's for human the formulation lah, but can be used in the veterinary practice as well. Okay. If you run out, okay, if you open up a clinic and you run out of Clavamox or Clavalux, yeah, so you can purchase augmentin because the active ingredient is the same. Only thing you must carefully calculate the dose, right, to give it to animals, right? Okay. This one I think I've shown you before. Okay, Clavamox, same thing, contain amoxicillin and calvolanic potassium. All right. So the formulation is in potassium lah. Okay, potassium is the vehicle, and this formulation, yeah, it's like this is for only for small tiny kittens, ill, sick, very sick kittens, where we use in drops. Okay, we calculate accordingly and give them in drops. Yeah. So for big animals, yeah, weighing 5 kilo, 5 kilo cats, and more than that, 3 kilo and so on, we don't give. Yeah, only very small and sick kittens where we find it very difficult to peel them, so we give in drops. Okay. So another injection, yeah, Noroclav, same thing, but in injectable form, yeah, contains amoxicillin plus calvolanic acid. Yeah, the name will tell you, Noroclav. Okay. So it's in the suspension form. Okay, the side effects, okay, so it has got very mild allergy reactions, yeah, can cause skin eruptions, angioedema, yeah, okay. So angioedema is a painless swelling under the skin, okay, right? So it is not very serious, I would say, yeah, but you get it, but it's not that serious, huh? And then the other one would be anaphylaxis. So this is a serious side effect. Okay, anaphylaxis is allergy reaction to foreign protein. Yeah, foreign protein or any other foreign substance lah. Okay, so anaphylaxis can lead to death because it can also cause bronchoconstriction, difficulty in breathing, and can lead to death. So that's why with penicillins, yeah, whenever you see a doctor, yeah, doctor will ask you, are you allergic to antibiotics? Are you allergic to penicillin, especially penicillin? Okay, but otherwise, if you are not, it's a very safe drug to use and very safe, very what do you call, efficacious, yeah, with a very mild side effects lah. Okay, except for this anaphylaxis. If you don't have it, you can use it. Yeah. All right. So if you have this problem, allergy problem, yeah, to penicillin, yeah, you can opt for the other drugs which have the similar spectrum of activity. All right. So the other side effects would be colitis, yeah. So penicillin can disturb the gut flora. In the horses, yeah, large doses can be dangerous because it will disturb the microflora in the horses, yeah. So because these microbes are used to digest food in the horses, yeah. And if you have large doses, it interrupts with it also kills the normal flora, yeah, normal bacterial flora in the gut. So that can lead to colitis, and later on colic and further complication lah in horses. Okay, so usually in horses, injectable form would be preferred. Okay, so far so good. Okay, this one I think I'll skip this. Any questions on the penicillin? Hang on a minute, I'm going to share another slide. Lost my button. This is okay, now we'll look at another beta-lactam drug. Okay. Let me share this. Okay. Everyone okay with penicillin? Any questions with penicillin just now?
Doctor,
Yeah.
Doctor, I have a question.
Mm-hmm.
Can we mix dexazone with amoxicillin because I went to a clinic
Mix what? Say again.
before.
What mix? What's the mixture?
I would like to ask dexazone with amoxicillin.
Sasan,
Amoxicillin.
amoxicillin plus
Dexazone. Dexazone.
Dexazone. Dexazone is a steroid. Are you talking about the
Yes.
steroid?
Can we mix both drugs because I went to a clinic before
Okay.
and I see
What is dexazone? Dexazone, you're talking about the steroid. This is a steroid, is it? Dexamethasone. Dexamethasone.
yeah, yes.
Okay. Dexamethasone with antibiotics, yeah. This mixture, is it?
Yes, doctor.
Yes, you can, because some of the formulation, yeah, for infection like eye infection, ear infection, yeah, drugs, yeah, in combined formulation, yeah, such as dexamethasone. Okay, dexamethasone is a steroid to reduce inflammation, and plus with antibacterial agent, any antibacterial agent, and plus also with antifungal. So there is a formulation, with 3-in-1 for oral ear infection. Okay, because in a ear infection you don't want to put like drops for fungus, for bacteria, and for inflammation. So we have formulation that drugs are combined. Yeah, the 3 drugs are in one formulation for ear, and plus also for eye infection. Yeah, it's in a combined formulation. Usually for red eye or conjunctivitis, yeah, we have steroid. Steroid is dexamethasone plus an antibiotic, yeah, to reduce the bacterial infection in the eye. So yes, there is a formulation which comes in the combined form, 3-in-1 or 2-in-1. Is that?
Doctor. Thank you.
Can, yeah. All right. Now we go to cephalosporin. Okay, cephalosporin is an antibacterial agent. So the what do you call, the learning outcomes are the same. Okay, so this is what usually I ask in when when I question you. Yeah, I will ask back. Okay, can you name me a few cephalosporin drugs or beta-lactam drug commonly used in veterinary practice? Then you should know. Okay, so I'm not asking the whole list, but I will ask like at least 2 in a group. Yeah, that's compulsory you to know. Okay. So here the brief kinetics, yeah, not very detailed. I won't ask you the elimination half-life, the clearance rate, the volume of distribution, no. But you know, the absorption, how is it being absorbed, the secretion, yeah, how is it being secreted, and so on. So brief mechanism of action, yeah, clinical uses and adverse effects. Okay. So again, this is very similar. Yeah, can you remember? Just now I showed the structure of the cephalosporin, but please bear in mind, I wouldn't ask you to draw this because we are not chemists. Huh? You students are going to be the end users, yeah, of drugs. Huh? You will use drugs, the formulated drugs. You are not going to prepare drugs. Huh? So this is important for a chemist. Huh? So just to show you, this is the beta-lactam ring. Yeah, so it has got this similar beta-lactam ring as penicillin. Okay, so cephalosporin and penicillin, they share the similar mechanism of action, the side effects, yeah, and the kinetic. Some of the kinetic parameters are similar because of the presence of the beta-lactam ring. And this beta-lactam ring is the one that confers the antibacterial activity. Okay, yang ni semua macam tak berapa aktif lah. Okay. My laser pointer. I like my laser pointer. It's because it's contrast to the blue color, so it's nice. Okay, right. So similar to penicillins, yeah. So the mechanism of action, the distribution, elimination are similar. Okay, so I don't have to repeat again. Yeah, you can just refer to your notes. So mostly not acid stable, so therefore they are given in injectable form. Yeah, that means there is as a tablet form, but most of them are in the injectable form. Okay, so not as sensitive as penicillins to degradation by beta-lactamase. Okay, so beta as compared to penicillin, yeah, this is quite sensitive against many organisms. It can resist the development of the resistance, yeah, provided we use it appropriately according to the dosage. Okay, not underdose or whatever. We can use this for a long time. Okay. Okay, right. So cephalosporin, okay, only 5 to 10% of individuals with penicillin allergies are also allergic to cephalosporin. Okay, so not all, and should be avoided in individuals with a history of anaphylaxis to penicillin. Okay, if you have a severe allergy to penicillin, then you should forget about using cephalosporin in the patient. So cephalosporins, yeah, there are several generations of cephalosporins. Okay, they go according to the year they were produced. So the first generation would be the pioneers, yeah. So this generation of cephalosporins, they're effective against gram-positive bacteria only. Okay, they are not very effective against gram-negative. Okay, and then for example, yeah, cefazolin, yeah, it is being used as prophylactic following surgery. The other drugs would be cefapyrin and so on. So these are the examples of first generation cephalosporin. Okay, but cefazolin, yeah, used as prophylactic, which means after not a very short surgery, but if there's a long surgery, long-standing surgery, yeah, like 8 to 12 hours, usually like orthopedic surgery, when you open up knee capsule and so on, it's a long surgery. Yeah, so you will expect that there must be, like when you open up, there are a lot of bacteria in the air, can get easily contaminated. Therefore, before the bacteria sets in and cause problem, yeah, secondary bacterial infection, drugs, yeah, some antibiotics are being used as prophylaxis. That means before the bacteria set in, you already start on antibiotics. Okay, usually after following surgery lah, okay, or during surgery. Okay, when you're performing surgery, yeah, they already start on antibiotics. Okay, but for a common flu or whatever, no. Okay, we don't do that. Yeah, there's no prophylactic antibiotic before you get flu, common flu or so on. So this is where we predict that contamination can occur because of the duration of the surgery. Yeah. So the second generation and the third generation, yeah. The second generation, yeah, products are mainly human products. Yeah, we can use in veterinary practice, but we must take the responsibility. We must be very careful with the dose, because the dose, yeah, it's meant for human. Okay, so as you know, roughly, like the weight of a man. Yeah, when I say a man, it includes in general, generic. It's about we take the weight of like 65 to 70 kg. Yeah, so that differs with our small creatures that we have, cats and dogs. So we must really careful with the dose, or else we can overdose the dogs and cats when you use human formulations. But with the third generation, third generation is effective against gram positive plus gram negative as well. So please bear in mind the first one, the first generation, it's only gram positive. So as they improve the formulation, and then the most recent generation of drugs, they have improved activity and also a broader spectrum of activity. Okay, so veterinary products, cephadroxil. So this is again third generation. We have third generation. Ceftiofur, okay, this is it's the third generation of cephalosporin. Okay, right. Is there a class after 11?
Yes, doctor.
Yes. What class is that?
Parasito.
Parasito. Okay. You were late just now. You had a class 9 to 10, yeah? Whose class was that? What class is that?
Immuno.
Huh? Immuno. Oh, okay. So, okay, never mind lah. So I think it's about 11. I think you have to start to join the other class. Okay, I will stop here lah. We will continue on Friday. Yeah. Is that okay? Okay. So far so good.
Doctor.
Any questions?
Yes, doctor.
Siapa yang bercakap ni? Imran. Imran ke apa? Okay. So all understood? All are clear so far? No questions?
None from me, doctor.
None. Okay. So none from who just now? What's your name? Rahana.
Mira.
Mira. Okay. So Mira mewakili kelas lah. So she said none. So I assume that the others, the rest, don't have any questions. So okay, I will stop the lecture, stop recording, and I shall see you on Friday then. Okay. So that's all from me for today. Yeah.